Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. We'll talk with experts on a wide range of topics, including nutrition, stress relief, sleep, mental health, etc.
And we'll dig into the issues that can cause fertility challenges, like PCOS, or early menopause, or cancer treatment.
So if you're curious about your fertility, whether you're ready to start a family,
or you're preserving your options for the future, let's dig in. Hey, folks. Hello. Welcome back. For those who are new here, or for those who maybe skipped past that intro, I'm Ruby Boris.
And I'm Ann Judge.
Hey, Ann.
Hi, Ruby.
How goes it in your neck of the Pacific Northwest?
It's pretty good. Spring officially just sprung for us, and we have daylight savings and all kinds of exciting stuff. But you feel like, I love that seasons changing feel. I feel like it's a good time to think about changes, and you're kind of getting past the slow, dull indulgence of the holidays. So I think we have a really good topic to talk all about that today.
Yeah, absolutely. And like you said, we just changed our clocks for perhaps the last time ever, which is very exciting. My cherry blossoms are starting to just begin the blooming process. And for those, when this episode comes out, you're going to realize that we recorded this a couple weeks ago because the cherry blossoms have come and gone by the time the episode comes out. But yes, I'm beyond excited for today's episode. It's going to be jam-packed. We have so many things. We're here bright and early, in the morning. And you might know this about me. My husband certainly does, but I am not a morning person at all. And he knows that for the first, good 2 hours after I wake up, he knows that he'll probably, if he asks me a question, he'll probably only get like a grunt in with an affirmative or negative inflection to it.
So this would be a wonderful podcast then, recording it, a little after 7 a.m. our time.
Yeah, but today I'm up. I'm amped. I've worked out. I've had my green tea. I'm ready to go. So...
Okay. I know I'm eating my breakfast right now as leftover overnight oats, but I'd made it for St. Patrick's Day, so it's green. So I did like the yogurt and the oats and the chia, but I pumped a bunch of food coloring in it. And so my husband saw me packing it up to go, and he's like, "Are you bringing ice cream to work?" Because he thought it was chocolate chip ice cream. I was like, "No, it's not quite that bad for breakfast." But it actually, everybody ate it. It worked out well. It was a good experiment.
That would be an interesting choice, mint chocolate chip ice cream, when we're going to talk about lifestyle.
Yeah.
Okay, so I have had the distinct privilege to have seen today's guest speak on a number of occasions and have learned so much from her each time. I'm so grateful to be able to share her knowledge with our listeners. And, some people fan out with like musicians or actors, but no, me, it's like academics and experts in lifestyle medicine and nutrition. So I am on it today. I'm very excited. We're going on a journey across the lifespan from about, beginning of the reproductive age through menopause and older adult years. One note before we get started, we'll mostly be focusing on the quote unquote women's health perspective. So for those that are vagina having individuals, those that have uteruses and ovaries, but a lot of what we discuss today could be applied to anybody on the gender spectrum, including those with sperm, testicles, and those on gender-affirming hormones. And one quick note before I introduce our guest too, we would love to see some 5-star reviews on Apple Podcasts. So if you're enjoying our show, take a minute to give us a 5-star rating and review. It doesn't have to be long, but those ratings and reviews really help make us more discoverable to others who may benefit from our content. So definitely please and thank you in advance. And with that, I will introduce our guest. So Dr. Michelle Tollefson is a board-certified OBGYN in Denver, Colorado, and a professor in the Health Professions Department at Metropolitan State University of Denver, where she created and oversees the Lifestyle Medicine Program and the Wellness Coaching and Lifestyle Medicine Pathway. Dr. Tollefson is a graduate of Creighton University, where she received both her Bachelor of Science and Doctor of Medicine degrees. She completed her OB/GYN residency at the University of Missouri in Kansas City. Not only is she board certified as an OB/GYN, but she has also received her board certification from the American Board of Lifestyle Medicine and fellowship in lifestyle medicine from the American College of Lifestyle Medicine, or ACLM, which you all have heard me mention a few times on the show. She is a lifestyle medicine leader within ACLM, as well as in the field of women's health. She founded and co-chairs the ACLM Women's Health Member Interest Group, as well as the Pre-Professional Lifestyle Medicine Education Member Interest Group. She serves as the ACLM Executive Board Secretary and serves on the Education and Member Committees. She is editor-in-chief of the textbook Improving Women's Health Across the Lifespan, an international speaker, women's health consultant. She leads the Paving the Path to Wellness groups and recently co-authored the Paving the Path to Wellness Workbook with Dr. Beth Frades and Dr. Amy Commander. She is currently writing a menopause and lifestyle medicine book with hopes to release in late 2022. So definitely we'll be looking forward to that. And on top of all of this, she is also a breast cancer survivor and thriver through the power of lifestyle medicine and enjoys spending time in Colorado outdoors with her husband and 3 children. Dr. Tollefsen, it's an absolute honor to have you on The Whole Pineapple. Thank you so much for joining us.
Oh, Anne and Ruby, thank you so much for having me. I'm excited to speak with you both today.
Yeah, this is going to be great. So how about right when we get started here, let's just talk about what the American College of Lifestyle Medicine is and what lifestyle medicine is. Give us kind of a rundown.
Sure. So the American College of Lifestyle Medicine, which is referred to as ACLM, is the professional organization of people who are wanting to help advance this field of lifestyle medicine. And when we refer to lifestyle medicine, I guess my definition of it, which aligns with the ACLM's, is the use of evidence-based healthy lifestyle practices to prevent, treat, and sometimes reverse chronic disease. It includes the 6 main pillars of nutrition, predominantly with a whole food, plant predominant diet, getting adequate physical activity, so exercise, managing stress in healthy ways, prioritizing strong social connections, avoiding risky substance use, and then prioritizing sleep, which is often not prioritized within our society. So those kind of 6 main pillars. And it's not that there's something new. There's not a magic pill. There's not a magic exercise tool that you need to go buy. It really is kind of all of the things that our grandparents probably told us to do. Eat your fruits and vegetables, eat more whole grains, don't eat that junk food, and get outside and move and be nice to your friends and go to bed at a good time. So all of those things. But what lifestyle medicine really does is it's elevating that field. It's encouraging research in that area. It's wanting to make this to advocate for it or to put it toward the forefront of healthcare, because we know that the chronic disease burden, especially around lifestyle related diseases such as hypertension, coronary artery disease, stroke, some types of cancer, those rates are so high. Type 2 diabetes continue to increase. And we know that a lot of it could be prevented and some of it could even be reversed through healthy lifestyle behaviors. So we're that group that's advocating for it. I joined the American College of Lifestyle Medicine over a decade ago when there were only a few hundred of us. I think I may have been the first or one of the first OB-GYNs, obstetrician-gynecologist, who was part of that group. And now we are over 7,500 members strong. And there are a lot of physicians like myself, but it really is, it's the whole team. It is everyone kind of coming together with their expertise and coming together in order to help patients improve their life through these healthy lifestyle behaviors. So we have nurses and nurse practitioners, PAs, pharmacists, dentists, PTs, OTs, people from healthcare management, from industry, wellness coaches, health and wellness coaches. We know behavior change is hard. We can have all the research in the world. And as a physician, I can tell someone, you should eat healthier and you should decrease your stress and you should sleep, you should get 7 hours of sleep. But if I can't help somebody with behavior change, then that information isn't that useful. So health and wellness coaching, evidence-based behavior change is an important part of lifestyle medicine too. So we really try to bring the whole team together. We're working on policy, advocating for just getting this out to the forefront and really providing the support at all different levels to make lifestyle medicine, to make it a reality for people.
And especially in an obstetric population, I feel like that's so important because then you're impacting the next generation as well. And that's something that we talk about so much because we're talking about preconception health and fertility and how these changes you make aren't just for your own health, but they really are something that you're going to pass on in terms of epigenetics and everything else. So I think you're right. This is such out of all the areas of lifestyle medicine, this whole idea of those that might become pregnant, I think is even more important.
I think it's even more important, but of course I'm biased. Yeah. Yes, I think it's tremendously important. I think it's great if somebody is diagnosed with type 2 diabetes. I want them to be introduced to lifestyle medicine so that they can try to reverse their type 2 diabetes or use it as a part of their treatment. But if we can work with that reproductive age woman so that she can embrace these lifestyle changes, she can impact her own life and her long-term risk of chronic disease, but also impact that developing fetus, or when she does have that developing fetus, and then it can impact even long-term that growing fetus or that baby's risk of chronic disease as well. And that's that whole field of epigenetics where we know a lot, but there still is so much we don't know. But we do know that what a mom eats, what she's exposed to while that fetus is developing does play a role in that health and well-being of her baby, not only throughout pregnancy with changing the risk of preeclampsia, with gestational diabetes, with preterm delivery and birth, with the size of the baby, but it also impacts the baby's risk for some chronic diseases down the road. And that's where it gets messy. It's complicated. It's exciting. It's interesting. It's not the whole story. So it's not if your mom ate junk food while you were in the womb that you're destined to have a life of chronic disease. That's not it at all. But it's part of the story. How much and how all those different things play a role, we still need to learn more about. But it's really exciting and interesting.
That's such a good way to phrase it, because I feel like a lot of people, when they hear things are messy, intuitively like, oh, well then why even bother? How can we study it? But I think a group of, science nerds like us are like, ooh, that's what's so cool about it. And there was just the interest yesterday or the other day about, research showing that people who've recovered from COVID-19 having this higher risk of developing diabetes. And so I feel like there is so much more understanding now of the complexity and the role of inflammation, and just all this kind of stuff, that diseases that we used to think of as just the disease itself, we now realize everything is playing into it. And that's, I think, what's interesting, and hopefully what's going to lead to, as you said, more and more research in the field, as opposed to just kind of tossing up our hands and saying, what are you going to do?
Yeah, I agree. I think it's exciting as well. But one of the things I've realized after working with patients for years is that nutrition especially nutrition, but nutrition, exercise, sleep, stress, all of those can get so complex that sometimes people hear all these different messages and they say, it's too complex. There's too much. Somebody's telling me to eat this. The next day I hear not to eat that. Somebody says, drink coffee, don't drink coffee. Mm-hmm. It can get so complex that for my patients, they're often like, that's great that you know all the research, but bring it down to me. What are some things that I can do? And so hopefully that today I can share some real kind of basic things that are, of course, tied in with the research, but some basic ways of thinking about things that can hopefully help your listeners who women with ovaries who are trying to conceive, or those partners who are trying to get pregnant.
Yeah. And, one of the inspirations for this podcast, or one of the biggest inspirations for this podcast, is the fact that a lot of our patients that come to see us, or those that are going through a fertility journey, they're at this pivotal time in their life where most of the time they're very receptive to behavior change for optimizing health, because they have this drive to make themselves the best that they can be to improve their chances of getting pregnant. So I think this episode is going to be really, really helpful for our listeners too.
So you have this motivated audience listening. How do you start when you're, like you said, trying to explain this to your patients in a way that's not going to overwhelm them? How do you really explain how we can try and optimize health?
Sure. So first I like to talk about like the time is now. A lot of people get torn into like, oh my goodness, I've ate crummy for years and years, or I've just, my relationship with food is complex because I've just wanted to eat in a way that is trying to do what society says I should do. I should eat a salad. I should do this. I should be a certain weight. So I try to get people to kind of separate that as much as possible, and to look at food as nourishment, and to create a vision in your mind of what you want your relationship with food to be like during pregnancy, and what you want your relationship with food to be like with your family down the road. Because it's I guess fear, or like you should do something, can motivate us for a short time. But the research shows that if we can connect something with our purpose or with a long-term goal, we're more likely to be successful. And when I talk about lifestyle medicine, it's truly a lifestyle. To me, diet is a 4-letter word. Exercise can be kind of like a 4-letter word to some other people as well. If they see it as I'm doing it because I should do it, I should look a certain way. I'm doing it to control my weight or how I look. And so I really try to get people to think of it as nourishment and move, the joy of movement, and then to realize the time is now. So to try to leave what's in the past behind, focusing on the time is now. And the reproductive age woman, the woman who is looking at getting pregnant, it's the optimal time. I think it's that teachable moment, or that teachable transition where you can make a significant impact. So the time is now. Leave it in the past, what's behind. Create a vision. So, close your eyes or spend some time journaling about what is your vision. Most people who I talk to don't want their family, even if they don't want their kids to struggle with food if they've struggled with it in the past. They don't want their kids to be eating nothing but junk food. I mean, a treat here or there. I don't like good food, bad foods, but they don't want their kids to be struggling with food, or struggling with weight, or having a negative relationship with food. Most of them look forward and say, look, well, I imagine that I would like my family to sit down for some family meals together. I want it to be a source of nourishment, of joy. Maybe we're cooking together. So creating that vision, and then realizing that your behaviors are going to play a role in creating or realizing that vision, and how that vision, I guess, connects with your purpose. You can get into that as well. We know that the behaviors that women engage in, or their eating patterns, patterns preconception typically can carry over to pregnancy. So we found that we can often see a greater change in that preconception time, even though pregnancy is a teachable time as well. And it's never too late. It's never too early. It's never too late to change your eating habits. But if we can help somebody in that preconception time, we can make an even greater impact.
Especially because so many people in early pregnancy have food aversions and nausea, and it's not always the ideal time to think about how to maximize diet, because sometimes you're like, I don't want to eat anything. So I can see how if you're going to change something, it's probably a little bit easier to do it when you don't also have all the hormones of pregnancy.
It's so unfair. I always talk to my patients because we see people in the early first trimester and they're just feeling gross and they are so ready and wanting to do everything right.
Perfect,
and wanting to have like the best nutrition and do all these things. And then they're like, all I want to eat is Cheerios. And I'm like, you know what? That might be okay for now. I want you to actually get some nourishment in you. And if that's all that you can handle for at this moment, you'll be okay. But it's so hard. And then the second trimester, when you're in that honeymoon phase, then we can really do everything.
Yeah, definitely. And I would say the Cheerios are not bad. If you can have some Cheerios and maybe a piece of whole grain bread. I'm not a fan of like telling people you have to take out this, you have to take out that, but trying to almost like crowd out some of those, maybe the foods that aren't as high quality foods, but try to put high quality foods in there. And then some of those kind of naturally go to the side. So when I'm working with patients, I try to get them to think in kind of broad terms of fertility supporting foods as being high quality, nutrient rich foods. And so if you think of maybe what you ate in the last day, most of you can kind of think of like, okay, so the high quality, maybe that I can think of the high quality foods in there, maybe the almonds or the apples or a piece of whole grain bread. And then maybe some foods that aren't as high quality foods. Maybe they're the candy or the soda, right? So once again, I wouldn't label those as bad foods, but they're not as high quality. And so when we are thinking about fertility promoting foods, we can go more toward the high quality side of the spectrum. Also fiber. I love fiber. Fiber is fabulous for females. And most women do not get enough fiber. Most people are in that like about 12 grams per day, but the recommendation for 19 to 30-year-olds is about 28 grams per day.
Oh, wow, that is
and
a lot.
So 95% of Americans are fiber deficient, and fiber comes from plants. And so if you're thinking about like, okay, so fiber is good for fertility. It also helps stabilize our blood sugar, so you're not doing that up and down crash. So fiber, if you can try to increase the fiber in your diet, and the way to think about that is eating more plants, eating things that look closer to like they did when they grew from the ground, eating things, as Michael Pollan says, that things that came from a plant that weren't made in a plant or something similar, or eat things that your grandmother would recognize as foods that don't have the really long laundry list of all the different ingredients. So increase fiber. So that's your fruits and your vegetables and your whole grains and your beans and your seeds and nuts and legumes. All of those really fiber rich foods, because that's been shown to help stabilize blood sugar, help with fertility. Those are typically your high quality foods. So like your soda and your packaged chips or candy, those are not going to be high fiber foods. Also, the benefit of is even in addition to supporting fertility, they also decrease constipation. They help you feel full longer. They have antioxidants, decrease your risk of cancer and many chronic diseases. And so you have a lot of those antioxidants and nutrients that are packaged along with the fiber for you and eventually for your developing baby. So when I see the pills that people are promoting, like, oh, this has everything that's in a fruit and vegetable, it's like, no, you're missing the fiber. And if you just take a fiber supplement, on the other hand, if you just take a fiber supplement, you're missing the antioxidants and the phytonutrients and all of those benefits. So nature has really packaged it perfectly in plants. And that's why I'm a fan of that. You still need your prenatal vitamin with your folic acid, even if you're eating a fabulous diet, but I'm a fan of plants and fiber.
Yes, I love talking to patients about plants and looking at food as a whole package, because things like soda and candy, like, although, I also don't like to label things as good foods, bad foods, but what are you getting from that food? What is it providing you? And if you look at things at the whole package, like you said, you have fiber and antioxidants and anti-inflammatory properties and all these things that are contained in plants. So I focus on fiber a lot, especially with my PCOS patients. When I do those consults, there's 3 tips that I try to give people. I'm like, there's 3 things, if we want to start like crowding some of those not as high quality foods out, I have people focus on the whole food as close to nature as possible, and then natural color, so not like neon orange Doritos. Yes. I'm sure my patients have heard me use that phrase before.
So you're saying the green food coloring I added to my overnight oats for St. Patrick's Day does not necessarily count as a green food for me.
It probably doesn't count as green food. Okay. And then fiber. And fiber, if you are even just focusing on fiber, you have to eat plants because fiber comes from plants.
You do.
And I was going to say, when you're making these changes, though, sometimes it can be, it means a change. And so if you're someone that's been following, the standard American diet, and then suddenly you do switch to a lot more fiber, I mean, do you expect to have some period of transition where you might feel bloated or you might feel different? Like, how do you prepare people and let people know about the timelines for when they might then start to feel better instead of just weird?
Yeah. So with fiber, and I don't think I'm the first one to say this, but it start low and go slow. So if you are eating the standard American diet or the Western diet, and most of you're eating a lot of processed meat and saturated fats and things with a lot of added sugar and salt, and you go completely whole food plant-based, your GI tract may have some challenges. So when you're adding fiber, and start low and go slow, but start moving in that direction. But people usually notice a change pretty quickly. Usually within a few weeks, they're really feeling better. So trying to move in that direction. I also like for people to do a fiber diary to see where you're at. A lot of people are shocked when they're like, well, I'm eating healthy. I eat this and that, or I eat, my cereal that I says that it has some whole grains. And then they actually look and they look at the fiber and they're like, oh my goodness, even though it might be fortified with some vitamins and minerals and a little fiber, there's not very much in it. So you want to really get in the habit of looking at the labels, or if you're eating things without labels, you are eating those, the whole grains or the fruits and vegetables, those are usually fiber rich too. You may have to look up how much fiber it is on your phone, but that's a great way of doing that fiber diary and then starting to move in the right direction. I also like Dean Ornish's spectrum concept. I'm a fan of Dean Ornish's for many reasons, but kind of that moving in the right direction. Like if you want to go all the way right away, that's fine too, but moving in the right direction. So seeing where you're at now, no shame, blame, or guilt. That's Dr. Beth Frady's, the president-elect of ACLM and somebody who I've had the joy to work with for many years, but she always talks about no shame, blame, or guilt. That doesn't help us with behavior change. And so how can we put that aside and then move in that right direction along that spectrum? And then also I think those whole foods, those fiber rich foods, and then also anti-inflammatory foods. So inflammation is bad for fertility. Inflammation is bad for fertility. So we want to do whatever we can to decrease inflammation for everyone, right? A lot of times what's good for a reproductive age woman and for getting pregnant is good for everyone, but it's really important when somebody's trying to get pregnant that they try to decrease what we call oxidative stress and decrease inflammation. And so when you eat fruits and vegetables, especially bright colored, so if you're looking for fruits and vegetables and I can pick between like a light green lettuce, or if I can pick a really dark, vibrant green kale or spinach, those I want to go more toward the darker of the spectrum is beneficial because they usually have more antioxidants, phytonutrients. And so when I eat those plants, those fiber-rich foods, those high-quality foods, they have antioxidants, which help to decrease the free radicals in our body. And free radicals you can kind of think of it as almost like when you see rust on some metal, that same process kind of happens in our body with free radicals. And so we want to increase antioxidant activity. We want to decrease free radicals, and we can do that through a high-quality diet that's plant-rich. Because when somebody does have a lot of free radicals and is not eating very many antioxidants or is eating more of the standard American diet, that can lead to more cell membrane damage, DNA damage, impaired cell division. And those are so important when a woman is trying to get pregnant. And so if we're seeing that cell membrane damage, DNA damage, it can cause problems with that follicle trying to grow, with that oocyte maturing. It can cause some problems with fertilization and implantation, and possibly even increase the risk of pregnancy loss. So I'm somebody who struggled with infertility too with my first two kiddos, and I never want somebody to feel guilty. Once again, it doesn't help anyone, but I don't want somebody to think that food is the whole story to this. I don't want somebody to think that if they have problems with pregnancy that it's due to food. Eating a healthy diet can support fertility. It's not the whole story, but if we can eat that high quality diet, it really does support fertility and trying to get pregnant.
And it's something we can do. I mean, that's such stress of infertility. People feel so out of control. And so it is at least one factor that you can try and make some changes in. And as you say, you can make them gradually. It doesn't have to be this completely new, strict regime that may not be sustainable if you go at it too hard.
Exactly. Or if you're going to have some ice cream, eat it with something that has some fiber too. So if you're going to have, if you're going to have strawberry, if you're going to have ice cream, maybe you have a smaller bowl, maybe you go toward one that has a little bit less fat, or maybe you put some strawberries on top of it or add a lot of fresh fruit along with it. And so you're able to do some different things that just move you in that direction. And then also, of course, decreasing inflammation. So smoking, insufficient sleep, excessive exercise, or too little exercise. So either end of the spectrum with exercise can cause inflammation. And then we have the inflammatory foods. So our inflammatory foods, those ones that are really high in added sugars. So I'm not talking about fruit. Fruit has its own natural sugar, and that is healthy. But if you have something that has a lot of added sugar, like the candy, right? Or something that is a simple carbohydrate, so like white bread or white rice, if you can move towards, or like white pasta, if you can move towards the whole grain pasta or rice or bread, those are better. For inflammation, also we see inflammation with processed meat. So like hot dogs, bacon, salami, lunch meat, and then too much red meat, added sugar and salt, those all increase inflammation as well. So I try to have people decrease those inflammatory foods and increase those anti-inflammatory foods.
I love that, and no shame, blame, and guilt, because I feel like that can be applied to both lifestyle changes, but also fertility. So I might borrow that when I'm talking to my patients
yes,
too.
Yep.
That is
That's Dr. Frady.
So supportive. Yeah. Yes.
Now, when you mentioned the fiber diet, do you have any apps or services that you like to recommend to your patients? Because I know it's hard. Like for me, I've tried a few different tracking apps, and yeah, like I'll put in that I eat an orange. It's like your sugar goal is blankety blank. Like they don't always, give you. They're not always looking at everything together.
Oh, the war on fruit, man. I have a soapbox, and it's all about fruit, because I'm just like, fruit is not the problem.
No, it's not.
Right.
It's not. I honestly don't have a favorite app. I probably should. But yeah, I usually just have people grab a piece of paper and do a fiber diary for a day or two, just to see. Often people are shocked, like, oh my goodness, my goal is 28 and I'm only getting 12 grams. And so then if they're able to move in that direction slowly, but I should check out the apps.
I'm just curious. I feel like there's so much out there, and I don't have a personal favorite, so I always like to ask.
I actually do. I have my favorite. It's super simple, and it actually doesn't focus on calories. It doesn't tell you about like too much sugar or anything like that. It's basically checking boxes of the things that you want to have. And that would be Dr. Michael Greger's Daily Dozen. It's super easy. You just check the boxes, and it has legumes and veggies, those leafy green veggies. I just like everything, including water. And it's hard to do. I've tried, and it is hard to get check boxes on every single thing every single day. But if you are getting a lot of check boxes on that app, you're eating a lot of fiber. So that's an easy app. There's no guilt with it.
It's called what? Daily Dozen?
Daily Dozen.
It's free. It's fabulous.
It's free. Mm-hmm. It's fantastic. And it's easy. You don't have to like enter all your food in. You basically it's super, for busy people, it's a great place.
Yes, that's great. I feel bad I did not think of that. But yes, Dr. Greger's Daily Dozen, it is fabulous, and it's very easy to do. I love it.
Oh, it's so great. It's my favorite. And in fact, I need to go in and check off my whole grain and my blueberries on there today.
Good. I'm working on my water intake.
Yes. That is something that I can always improve on, is my water intake.
So a couple of things also when you're thinking about fertility and food, I want to mention omega-3 fatty acids, because there's some good research out there showing that omega-3 fatty acids support fertility. It might support egg development, quality, and also implantation. But of course, we need more research, like so many areas. And we believe it supports semen quality in men. And so looking for your high omega-3 fatty acid foods. And so these are going to be in many of your nuts, such as walnuts. Walnuts are my favorite. I have a giant bag of walnuts from Sam's or Costco in my cupboard at any one time, and I try to eat at least a few of them every day. Or seeds. So seeds like flaxseed and chia seeds are also great sources of omega-3 fatty acids. And then also fish. I know some of your listeners probably eat fish and some don't, but fish, especially your cold water fish, such as salmon, tuna, sardines. There's some different apps that you can use also that help you look to see which fish have less mercury in them. But looking at getting adequate omega-3 fatty acids is important for people who have ovaries and for both genders who are looking to get pregnant. And then also one other thing I wanted to mention too is we're talking about eating a lot of whole foods, which is great. And some of your listeners probably identify as vegan or vegetarian. And for those listeners, I think it's really important that they connect with a dietitian. I've met so many women who identify as a vegan or vegetarian, but who think they're healthy, but then are nutrient deficient. Actually, we have I would say, an epidemic in pregnant women of nutrient deficient women who are malnourished, even if they're getting enough calories. So we really need to look at their nutrients, but it's important to mention too, B12, vitamin B12. And it's important for women to get adequate B12. And if people are eating animal products like milk, eggs, fish, meat, cheese, they're going to be getting B12 that way. Or there's also like fortified breakfast cereals, yogurt, but we need to make sure people are getting adequate B12, because not having enough can negatively impact ovulation and possibly implantation. So getting it through the animal products, or if you're doing the whole food plant predominant way of eating, which is what I follow, I recommend doing a B12 supplement and talking with your dietitian and finding out the right amount for you. So just a couple of caveats before we get into the microbiome.
Yeah. And just a note too on that. So vegan, vegetarian in pregnancy is totally doable.
Oh, yes.
Absolutely
Yes.
doable. You can have a very well-balanced vegan or vegetarian pregnancy. Actually, I was not vegan for my first pregnancy, and my second pregnancy, I was vegan the whole way through. And it's really important to find a provider who is supportive, because some people aren't as educated about it, and some prenatal providers might hesitate to let you follow a vegan diet, but it's absolutely doable. But I think that's a great idea to partner with a nutritionist to make sure you're checking all your boxes.
Yeah, and that's great, Ruby. And I agree. I have definitely for my last couple of pregnancies was whole food, plant-based. And I think it's completely fine to do that during pregnancy. I do agree with you that it's important to be seeing a provider who can make sure that you're getting all of your adequate nutrients, either your midwife, your OB-GYN, your nurse practitioner, your PA. And if you don't have somebody who feels comfortable with that, then seeking out a dietitian to support you through that process, just to make sure you're getting nourished for you and that baby.
And for those that find that all sounding really, really intimidating, if you're not going vegan during a pregnancy, you're still going to get all these benefits by becoming more plant forward, by making those shifts. So don't feel like you have to go all in or you're not going to see any changes.
Exactly.
Yeah. In your talk at the ACLM conference back in the fall, there was a lot of discussion about the spectrum, and I really appreciated that too, because any step towards that whole food plant-based diet is better than the step before it. So not to feel like you have to be completely whole food plant-based vegan like tomorrow. Every step counts.
Yeah, exactly. Yeah. And most women in the United States, get too much of their daily caloric intake from added sugars and too much from saturated fat. And so already we're a nation that is often nutrient poor and calorie dense. And so whatever we can do to kind of shift that is beneficial. It's beneficial. So if you are struggling with not having, I guess, the diet or the nourishing foods that you want, know that you're not alone, that the struggle is real. It's hard in our society where we're bombarded with all of these different food marketing and messages and fast food. I'm a busy full-time working mom too. And sometimes when I drive by all those fast food restaurants, it would be so much easier to swing by and to get that, but always just trying to make the healthiest choice that you can at that time and move in the right direction, I think are powerful messages.
So we've talked a lot about fertility, and we talked about fiber, and I feel like that's a really good segue into the gut microbiome and just microbiome in general, because I always find it interesting that constipation is one of the most common chronic diseases that no one talks about. And it's just like, why do we have to struggle with this? This is something that our body should do well, and it's so uncomfortable.
It's interesting, Ruby, I was telling you the conference I was just at, that speaker on endometriosis, in her case studies, like half of her cases, they were actually suffering from constipation, and they didn't realize till they went in for their laparoscopic surgery, like, actually, we don't see any endo, but wow, is there like impacted bowel, and taking care of that, and how that fixed the symptoms that they had been diagnosed with for endometriosis. So It is something that we just don't talk about. If you think you can actually have a whole exploratory surgery to be diagnosed with constipation.
All right, well, let's talk about the microbiome.
So yeah, the microbiome, and your listeners may have already know some about this, but the microbiome, the gut microbiome. So the microbiome, we have gut, we have bacteria that live on our skin, that live in the vagina, that live in our intestines, in the mouth. So all over our body, and bacteria are very helpful. We often think of bacteria as being the enemy, and sometimes they can be if we have like an infection, but we need bacteria in order to thrive as human beings. And so when you hear somebody talk about the microbiome, they're typically talking about the gut microbiome, or the bacteria, the virus, the fungi, all the different, those microorganisms that live in our intestines. And so it's predominantly bacteria. So we usually think of the bacteria that live in our digestive tract. And so though the bacteria or the microbiome, that whole family, it plays in a really important role. And so there are many bacteria and other organisms that are beneficial for our health. They help with how we metabolize and use foods and nutrients. So they help us get nourished from the food that we eat. They also help with certain hormones. And so they just play an integral role in our overall health. if I like to think of it as we need to feed the bacteria that are keeping us healthy. And so I almost think like there's this population of bacteria, and I don't want them to starve. And they need fiber. They need nutrient-rich foods in order to eat those foods, in order to digest them, in order to get the nutrients that I need. They also create this mucus layer. And so when they're healthy, they're producing short-chain fatty acids, which are beneficial to our health. They're also creating this nice mucus layer in our intestines that help keep what is in the intestinal tract in, and only allow the nutrients and the good things to go through to our bloodstream and to go through to the rest of our body. And it keeps what shouldn't be in there. It keeps it in the intestines and moving out through the intestinal tract as poop. And so we want healthy bacteria to help keep this nice mucus barrier. You don't want your bacteria to starve. You don't want your gut microbiome to be starving. And so if you're not feeding them with adequate fiber and high quality foods, if they're just seeing white bread and processed meat and junk food, you might be what is considered an ideal weight, but you can be very unhealthy. You can be starving your bacteria. We have a lot of people in the United States who might be of normal weight or who might be overweight, but whose gut microbiome are starving. They're not getting the nutrients that they need. And then you don't have that mucus layer. You get what's called bacterial dysbiosis. So that means not enough good bacteria. And it allows some of the bad or the bacteria that aren't as beneficial for health to populate. It can lead to inflammation. So while we were talking about inflammation is bad for women, for everyone, but for people who are trying to get pregnant, it can lead to increased inflammation when we don't have that nice mucus layer. It creates problems with our hormones. And we know hormone levels are incredibly important when we're trying to get pregnant. So our estrogen level, there's a whole group of bacteria with part of the microbiome called the estrobolome. And those are the gut bacteria that metabolize and modulate estrogen. And so we need to be getting high quality foods. We need to be eating those. We need to be nourishing and feeding our microbiome with eating lots of plants, with eating high quality foods that have a lot of fiber and phytonutrients. Then we're able to nourish our bacteria that are able to make sure that our hormone levels stay as they should be, or to help keep our hormone levels normal. They also help with our mood. It helps with, like, there's Uma Naidu has a book. I think it's Your Brain on Food, a Harvard psychiatrist, fascinating with the food that we eat impacts our mood and how we're thinking. But we need to keep the estrobolome, or those gut bacteria that are helping with estrogen levels, happy, because otherwise, if we don't, our estrogen levels can be too high, and that causes some different problems, or it can be too low. Fiber helps to help the extra estrogen be able to leave our system through feces or through poop. And so we don't want extra estrogen just hanging out in our body, because that throws off our chances of getting pregnant if we're trying to get pregnant, and also too little. So it's really important to keep that appropriate balance, and that's through eating healthy foods. And then it helps, of course, with constipation too. Like if you're not eating enough fiber, you're going to have problems with constipation. And constipation goes along with that. So feeding your microbiome and just really thinking, when you make the choice to eat something, you really are trying to nourish your body. You're trying to nourish your microbiome. You're trying to nourish your body. Women have kind of been told it's about their weight. It's about trying to make themselves do a certain thing, and you should do this. And it's not. Food really is nourishment. It's nourishment for ourselves. It's nourishment for our bodies, for the bacteria that help us to be healthy, and for your future developing fetus.
I was just gonna say, I love that whole philosophy. I had never thought about that before, how it's coming from a place of love and nourishment, as opposed to punishing or like knocking out bad bacteria, or coming from a place of, this losing battle, basically. Instead, it's thinking about how you can feed yourself in every possible way, down to the bacteria. I think that's such a great way to think about it.
I actually just got a book from the library for my kiddos, and it's called The Good Germ Hotel, and it's all about the microbiome, and it explains it like it's so cute, and it explains the microbiome in such a wonderful way.
Yeah, because you don't want to terrorize kids. Being like, you're swarming with bacteria might be a little bit of a scary idea.
No, it's like, we're all partners, and we're all supporting you. We're awesome. We love you. Thank you for being our home. It's really cute. So The Good Germ Hotel, if you want to talk with, it would be great for adults too, just to learn exactly what the microbiome is in an easy way, but it's adorable.
When you like to think about the fact that you are in this symbiotic relationship, and that your body wants to help you. And I remember back in nurse practitioner school talking all about your lactobacilli and how they're the warrior princesses of your vagina, and they're there trying to keep the balance and good control. Yeah, that's what they are. These are your Xena warrior princesses, and that's what I always think of now still. But it's true. You have a lot of support that's there, trying to help you be your healthiest, but you have to help your body by feeding it what it needs.
Most definitely. Also, when we talk about the microbiome, also the vaginal microbiome is really interesting and important for women of reproductive age. And we talk a lot about the gut microbiome, but there's also a vaginal microbiome that has the vagina has a variety of bacteria, some that are what we call good bacteria and some that are bad, though some that are health promoting, though there's a variety of bacteria, but like we want lactobacilli, and those are some that really help keep the pH where it should be. So in addition to, there's a lot of research on diet and how that helps our gut microbiome. There's also some research, not as much, we need more, but research out there showing that a high quality nutrient rich diet, especially vitamins A, C, D, and E, that those help with having a healthy vaginal microbiome. So also calcium, folate, beta carotene, a diet that's low in saturated fats. So that's animal products, but like trying to not have excessive amounts of those. As an American population, Syrian American diet, we usually have excessive amounts of those. So trying to limit or decrease that intake, and then decreasing added sugar, that those are associated with vaginal health. And a lot of times people think, okay, well, they may have heard of bacterial vaginosis or BV, which we can treat with antibiotics. But it's more than just an annoyance. It can increase the risk of sexually transmitted infections. It can increase the risk of preterm birth, contracting HIV. Possibly, it may have the potential to accelerate the development of a human papillomavirus to cervical cancer. So it's important to have a healthy vaginal microbiome as well. And what we eat supports that, though we need more research in that area too. So another reason to try to eat a high quality diet.
Yeah, and wanting to prevent bacterial vaginosis in the first place, because you don't want to take antibiotics, because antibiotics are going to also affect your microbiome. So
that's right, your gut microbiome and the vaginal microbiome, for sure.
But you can also rebuild the microbiome. I remember when I was in my postpartum haze after my daughter, she kept getting ear infections and kept having antibiotics, and I was like, but we're ruining her microbiome. So how do you make people just not be scared of everything? How long does it take for your body to kind of help recover and start working towards a better path?
Yeah, because if you need antibiotics, you need
most definitely. Yeah. I know that it can change pretty quickly. I guess I don't know specific numbers, but I know that it can change pretty rapidly. So, we see a change in the microbiome or the bacterial profile in people when they start to make dietary changes, I would say within a week or two. And there's statistics as well, but yes, for sure. So don't distress if you've recently had a lot of antibiotics. Antibiotics definitely have a role, and lifestyle medicine is not about shunning conventional medicine. It's taking medications when they are appropriate. Antibiotics definitely have a role. We don't want to use them. You don't want to use a friend's antibiotics and use them for things that aren't for viral infections, which aren't treated with antibiotics, but you do want to use them when appropriate or recommended by you, Anne or Ruby.
Yeah. So sticking in that reproductive age, maybe even the teens and early adult years, but it really could affect any time in the reproductive age. So PMS and dysmenorrhea, also two things that are very common, something that people with ovaries and uteruses suffer from.
Definitely. So let's talk about dysmenorrhea first, or painful periods, painful menstruation. And it is a super common gynecologic problem worldwide, one of the most common problems that we see. And it is, for those of you who may not know, it's that pelvic cramping that begins around the time of menstruation, typically lasts for a few days. And it can be, I would say that society has kind of said, oh, this is an annoyance, that women should just, there are people with ovaries or a uterus who just kind of power through this, but it really can be disruptive. People sometimes miss work, miss school. And so it's a problem. There are a few theories for why it happens in the role that nutrition plays. There's a theory that it might be due to an imbalance between our typical omega-6 fatty acids that are found in a lot of the typical Western diet, that may potentially contribute to dysmenorrhea, that increases the inflammation in the body, and not enough omega-3 fatty acids. And so you have omega-3s and omega-6 fatty acids, and the Syrian American diet has a lot of omega-6s. Ultra processed foods have a lot of the oils that aren't as healthy as like an avocado oil, and not enough omega-3 fatty acids. I'm a fan of omega-3 fatty acids in olive oil, and the other like the nuts and seeds we discussed earlier. So that may contribute to it. There's also some different thoughts around having a thicker uterine lining. And so we know that high fat foods, especially like our high saturated fat foods, can contribute to excessive or higher levels of estrogen, which can lead to a thicker lining of the uterus. And then when that sloughs off, if the lining is thicker, when it sloughs off, it might result in more inflammation and uterine contractions and pain. We don't know the full story, but there's some research showing that eating a higher quality diet can be of benefit. Also, there's some interesting research around dysmenorrhea. And so there's different types of dysmenorrhea as well. Primary dysmenorrhea is when we've kind of ruled out some of those other causes of dysmenorrhea, such as we've ruled out endometriosis or we've ruled out another anomaly that's causing it. But if primary dysmenorrhea, some interesting research around beverages. And so we know that cola drinkers, people who drink sodas, have an increased risk of dysmenorrhea. So a lot of reasons to try to decrease soda intake or get rid of it altogether. But one of those reasons may be dysmenorrhea. Another, we see that alcohol and caffeine intake, that those are associated with an increased risk for primary dysmenorrhea. So trying to limit or avoid alcohol intake and also watching your caffeine. And sometimes people will say like, oh, do I need to stop caffeine altogether? And I say, you know what, do that diary, give it a try it, decrease your caffeine or stop caffeine for a while and see if it helps you with your dysmenorrhea. And then you'll know. Green tea and possibly oolong tea, and maybe there's even some research around rose tea are associated with a lower prevalence of dysmenorrhea. And the rose tea, there was some interesting research around the use of it with dysmenorrhea in adolescents, that it may decrease pain and also distress due to dysmenorrhea. And then water intake. We often don't drink as much water as we should. So increasing water intake can reduce menstrual bleeding duration and also pain intensity. So those are some different things you can do to switch toward those healthier beverages that can be beneficial as well.
I think that's important too, to realize you don't necessarily have, like, you can experiment on yourself. We talk all the time about one of the challenges is that you're an N of one. And so sometimes you think, well, this is just what periods are. They're just really painful. But also that means you are your own subject. You have the ability to trial some things and see if maybe for you it does make a difference, even if you don't have to understand exactly why.
Exactly. We also know, so coming back to inflammation, we know that inflammation is associated with pain as well, a lot of different types of chronic pain. But dysmenorrhea and some different dietary patterns that are often pain promoting, including some of the research with dysmenorrhea, are the snack food eating. So when we're snacking throughout the day on a level we consider like typical junk snack foods. And then also eating a lot of meat has been associated with increased pain promotion during menstruation with dysmenorrhea. And then also skipping breakfast. An interesting study that showed that skipping breakfast was associated with increased dysmenorrhea. And then some of the research has shown that pain reducing or dysmenorrhea reducing diets may be fiber rich, surprise, right? Fiber rich, anti-inflammatory, micronutrient rich. So eating a lot of those plants again. And then also olive oil, extra virgin olive oil. If you do use extra virgin olive oil, you want to try to use it when you're cooking at lower temperatures, or use it like on a salad or something after you've cooked. You want to stay with using it under 350 degrees. Anytime I'm cooking over 350 degrees, I'm using avocado oil or spray. And you do have to I guess, be cognizant of that your oils are very calorie dense. So if you are trying to work on weight or optimizing your weight for fertility, which is important as well, that you're mindful of that. So I think that's some interesting information around dysmenorrhea as well, is that you can do some different things that will hopefully help you to deal with pain during menstruation that also support your fertility too. And so, yeah, a variety of different studies, but some interesting work around dysmenorrhea and food.
I know cross-cultural research could be very challenging, but are there studies out there? Do you find different rates of dysmenorrhea in like Mediterranean or Asian countries, or has anyone kind of looked at that? I guess it's so hard to sort out in terms of people's perceptions and reports of pain as well. I'm just curious.
Yeah, I don't know the data offhand. There may be a study out there. Now you make me want to go look and dive into the research to see what there is. If I had to guess, I would guess that it's lower in places that had more of an anti-inflammatory Mediterranean diet. I would. I
guess it's a good. There's probably just not a lot. There's just not as much research on these conditions that are seen as just part of the spectrum of having ovaries and uterus, and that's the challenge. So
exactly.
Yeah, and there's not a great incentive for nutrition-based research either, which is unfortunate. Like, so it kind of falls into two of those categories. But now I definitely want to go down like a dysmenorrhea rabbit hole later today on PubMed.
Well, it's funny because I remember one of the earlier podcasts you talked about how like the avocado lobby is not like funding all this research, but the avocado people can make a Super Bowl ad every year, so they do have a decent amount of money. So.
I know. No, I wish there were more research in this area. Neil Barnard with Physicians Committee for Responsible Medicine has done some great research around food, whole food, plant-based, low fat, anti-inflammatory diets. But yeah, we definitely need more.
And his book,
Your Body in Balance.
Your Body in Balance is great for those with ovaries and uteruses. Talks about endometriosis, dysmenorrhia.
And we'll list these books that we've been tossing out as titles in our show notes so that people who are listening can find them later.
Yeah. So Your Body in Balance by Neil Barnard.
Do you want me to talk about PMS real quickly?
Yes. Let's go into PMS.
Sure. So PMS or premenstrual syndrome, we think that about 30 to 80% of reproductive age women experience PMS, and it causes those recurrent physical or psychological symptoms prior to menstruation. They typically resolve with the start of menstruation or within shortly thereafter. Once again, we desperately need more research, but when I have somebody who has PMS, I recommend that they keep a diet log, or that they keep a log of what they're eating to see if they can find things that happen to trigger it. Some great research around the importance of whole grains, a really great study where they took a group of nurses and they randomized them into two groups. Half of the group had no intervention. They just kept eating what they were eating. And the other half, 50 of those nurses, they were asked to switch at least 4 of their servings of refined grains to whole grain bread. So a simple study, and they followed them. But compared to the control group, the intervention group had a significant decrease in their general PMS symptoms, their mood, their physical, their behavioral symptoms. So really interesting. And that's something that's so easy because, once again, everyone can benefit from eating fewer refined grains. Once again, those are your like white grains or your ultra processed foods, your snack cake that's all processed and that you buy at the grocery store. If you make your own muffin with some whole grains, that's so much better. So trying to substitute out some of those ultra refined foods or ultra processed grains for whole grains. We also know that people who had, there's some other research that showed that people who were in the highest quintile or the highest group of non-heme dietary iron intake had a lower risk of PMS. And so trying to eat more iron-rich foods that come from plants can be beneficial as well. Like we get iron from spinach. There are a lot of foods that have iron that we don't even think of. A lot of times people think, oh, I have to get my iron from meat. We also, once again, the PMS promoting foods are going to be those inflammatory foods, those foods that are high in added fats and sugars and salts. All of those are associated with an increased risk of physical and emotional symptoms in women with PMS. Women who don't have adequate calcium and dietary vitamin D, that those are associated with increased PMS. So wanting people to make sure they eat foods that have adequate calcium. But all of those fruit consumption, we see that has associated with a decreased risk of PMS behavioral symptoms. So trying to get people to eat adequate fruits and vegetables. Really, it just all comes back to eating that well-rounded diet that has that's rich in whole foods, that's rich in plant-based foods. So even when we look at other gynecologic conditions, which I won't go into now, but menorrhagia, like heavy menstrual bleeding, fibroids, we just see a significant association with so many of our gynecologic conditions and lack of a high quality diet, which increases the risk of some of these different conditions. And so just moving toward that high quality diet, the fiber rich diet, the phytonutrient rich diet, the eating a rainbow of fruits and vegetables. You don't want your dinner plate to just be all white bread and, white bread, yellow cheese and nothing else. You really want it to be a rainbow. You want to, because all of those different colors and they're associated with different antioxidants, phytonutrients, and different vitamins and minerals that you need to be nourished, that your baby needs to be nourished. And you really want to try to get that rainbow of foods on your plate.
Awesome. Let's see. Should we move towards like menopause now, do you think?
In just a couple minutes, like always, menopause gets the short end of the stick. You get this like short, as a woman now in my mid-40s myself, I'm like, wait, all this focus on the other conditions. But yeah, I think obviously all these things are important throughout the lifespan, but what becomes a little bit different as we look at menopause? What else do we need to pay attention to try and help combat some of those symptoms?
Sure. So menopause is a fun area, especially since I'm working on a book for it right now. And I went, as a breast cancer survivor, I went through menopause about a decade early. And so I'm passionate about breast cancer risk reduction and then also about menopause. And what's exciting is that there's not one type of diet that you should follow in order to decrease your risk of breast cancer. Another one you should follow in order to get pregnant or increase your chances of getting pregnant. Another one that you should follow for menopause. Really, it's the same one. It's just some different interesting research and some different nuances. But with menopause, there's research showing that the more health promoting behavior somebody engages in, menopausal symptoms typically decrease. And so that's often your hot flashes, your night sweats, which women start to experience. A typical age of menopause in the United States is about 51, but people often start to experience some of those, what we call vasomotor symptoms or hot flashes and night sweats, starting in their mid 40s, and maybe even like earlier 40s isn't too unusual. And so they'll have some of those hot flashes and night sweats. Those are often very bothersome for women. We know that we see those changes in part due to the changes or the fluctuations in estrogen that occur as someone moves toward menopause, as those ovaries start to decrease their production of estrogen as they don't release an egg as regularly. And so there are foods that have phytoestrogens And those phytoestrogens can sometimes, they stimulate some of our estrogen receptors. In some ways, they stimulate them just a little, not as strongly as our own estrogen would stimulate them, but they stimulate them just a little. And in other types of estrogen receptors, they can actually block it. And so if we use phytoestrogen rich foods, and those are often our soy foods, minimally processed soy foods, I prefer to like supplements or soy powders or isolates. But if we eat those soy foods, they are sometimes associated with a decreased risk of hot flashes and night sweats. They also might increase vaginal blood flow and lubrication, which can be a problem for many women as they go into menopause, having problems with vaginal dryness. They also, phytoestrogen-rich foods are soy foods. So that's your edamame. I love edamame. You can pop them out of the shells. They're great for kids too. They like to eat edamame where you can pop them out, just microwave them and then pull them out, and you can, or steam them, you can eat them, or tofu or tempeh or miso. There are a lot of different ways you can get your soy, but it helps some women as far as menopausal symptoms. For some women, it doesn't. And so there's more research going on there, because it might be because we have different populations of bacteria that can do some different things with converting certain products. And maybe that's why some women find benefit from their menopausal symptoms with soy and some women don't. But soy is often probably the most exciting, I guess, topic of conversation when it comes to nutrition and soy. And Neil Barnard that we mentioned earlier, he had a great study that came out where they randomized some women, menopausal women, some got a half cup of whole cooked soybeans every day with a low-fat vegan diet, and then others did not have that requirement. But the people who had the low-fat vegan diet with the soybeans had significantly fewer menopausal symptoms. It decreased their hot flashes and night sweats, and also increased their menopause quality of life. And so then also, like for hot flashes and night sweats, women who are experiencing those can drink cool beverages. Some women find that their hot flashes and night sweats are triggered by alcohol, caffeine, spicy foods, or hot beverages. But eating a whole food, plant predominant diet that's calcium and vitamin D rich, protein rich foods, that's all been shown to help women going through menopause as well. So once again, just that healthy diet. And then a lot of what we see with some of the research around food and menopause also circles back to sexual health, which is important across the lifespan, across for everyone, I guess, who is sexually active. And so sexual health and lifestyle medicine is one of my favorite areas to discuss. And if you want to have me back, maybe we can talk about it in further depth. But
absolutely. Yeah. I was just thinking, this is a whole hour of itself.
It is. But not surprisingly, what's good for the rest of our body is good for sexual health as well. We talk a lot about erectile dysfunction in those who have penises and testicles, and it's common. And we often call erectile dysfunction the canary in the coal mine, because often we'll see that when someone is having problems with the vessels in the penis, and then it often means if we're seeing vascular problems in the penis, that we're also going to see it in the heart. Not always, but that's when we start to think like, is there vascular disease somewhere else? But there's not a lot of research, or we haven't talked a lot about when a woman has decreased vaginal lubrication, or is maybe having some challenges with arousal or lubrication, that can be due to vascular disease as well, because eating a healthy diet, decreasing inflammation, all of those are good for female pelvic vasculature as well, which is important for having adequate arousal and lubrication of the vagina and normal sexual function. Now, of course, it's not all, just like fertility is not all about food, even though there's a connection. Sexual health is not all about food as well. There can be many different reasons why someone is having struggles with or having sexual dysfunction. About 43% of all women report having problems with sexual dysfunction in at least one domain. So many different reasons. Happy to come back and explain how exercise and stress and sleep and connection and all of that.
We're going to email you right after this, and we're going to try and set up a second time, because I definitely want to talk about this more.
But lifestyle plays a role in that as well. And so I think too, especially your listeners who are trying to get pregnant, working on all the lifestyle medicine pillars. We've been talking a lot about nutrition today, but also trying to get in some movement, not too much, not too little, working on stress management in healthy ways, avoiding risky substances, working on their communication, prioritizing time for connection, and getting adequate sleep is really important for sexual health and well-being too.
And just again, all of these changes, how they can come from a place of joy and love for your body instead of that place of shame and blame. I think that's so key for all of this. These are changes you're making because you love yourself, not because you feel bad about whatever you might have been doing in the past.
Yes. I think too that when people start to do these changes, they start to notice changes in other areas too. So sometimes people will come in and say, oh, I'm really struggling with dysmenorrhea. What advice do you have? And so we can talk about medications, because I'm not opposed to those as well. I believe they have their role. And I also like to talk about lifestyle modifications, but often they'll say, I changed this because I wanted to work on dysmenorrhea and I saw a change in that, but also my acne is better. And also my constipation is better. And also I noticed that it improved this and that. So these are all different things that have, once again, great side effects, right? And if we try to make ourselves do anything that's uncomfortable, we won't continue to do it. So how do we make these changes in a way that where they're sustainable? They really do need to be lifestyle changes that add, as Dr. Ornish says, years to our life and life to our years.
I love that so much. And really, what we talked about today can be applied, as I mentioned at the beginning of the show, to anybody across the gender spectrum, any time of your life, for any condition. Really, there was a theme here. So super exciting. That's also kind of empowering too, to know that it's less confusing. There's not a different set of rules. I don't want to call them rules, but guidelines, things that you should be doing for each part of your body. It's all connected.
You get the one body. It has to last you your whole life. So these changes that we make now, exactly. No, I found this was so helpful and also so encouraging, which is great, because I think sometimes people think, oh, I'm going to hear a talk about lifestyle, I'm just going to feel bad about myself. But I think this is exactly the opposite.
Absolutely. Do you mind if I mention the Paving book as well? Because that might be beneficial to your listeners as well.
Yeah. Of course, yes.
So behavior change is definitely hard. When you were mentioning the N of 1, that's something that Dr. Beth Frades talks about as well, as that, investigating yourself. And so what works for you may not work well for somebody else. For you, it might work well to have the apples cut up with a bag of almonds in your purse. That might be what you need in order to be, to have a healthy snack. And for somebody else, it might be something totally different. But investigating how you feel when you make these changes, investigating what you need to be your healthiest and your happiness. And Dr. Beth Frades started a program called Paving the Path to Wellness over a decade ago at Spalding Rehabilitation Hospital, a 12-week program where participants met once a week. It used to be in person. The pandemic has changed some things, but where they would cover paving steps. And that's an acronym. So Paving stands for physical activity. A is attitude. V is variety. I is investigation. So investigating what works for us. N is nutrition. G is goal setting, because we need that behavior change in order to lead happy, healthy lives. So that's paving. And then steps is another acronym. S is stress management. T is timeouts, taking time for ourselves. E is energy. So how do we manage our energy? How do we use substances that, natural substances are ways to increase our energy or to promote energy management that are healthy. P is purpose, connecting all of this with our purpose. There's a reason why we want to do this. It's not, but for most people, it's not just to look a certain way or to fit into society's shoulds. It's often that they want to have more energy to play with their family. They want to have more, they want to be able to give back to the world in the way that they feel is appropriate for them. So that's STEP. And then there's 2 S on steps. One is for social connection and the other is for sleep. So paving steps. And Dr. Beth Frades created this, and then Dr. Amy Commander modified it for breast cancer survivors. So as I actually went through her program, it was offered online toward the end of the pandemic, and went through it as a patient and myself as a breast cancer survivor, and fell in love with it. And then I was able to offer it for the first time outside of the Harvard Health System as well. But paving steps, we have a Paving the Path to Wellness workbook. That's a 400-page workbook. So it's a big workbook, but it helps people go through those different steps. It's not fertility specific or people of ovary specific. However, it's good for everyone. And it goes through a lot of what we've covered today. Plus, I would say more on attitude, variety, investigations, goal setting, purpose, energy, timeouts, some different things like that, as well as like exercise and sleep and stress that we just didn't have time to get into today. So feel free, it's available on Amazon or through Healthy Learning, the publisher, and Dr. Beth Frades is the lead author, and Dr. Amy Commander and I are co-authors. All of the proceeds go back to a nonprofit. So Dr. Frades Commander and I don't take any proceeds from the book. All of that goes back to the Paving the Path to Wellness nonprofit organization to support the health and well-being of others. So if that can help you along your journey, feel free to check it out.
Amazing. And we will list that in our show notes as well. And then if you go to our website, we have a link to our Goodreads page and our bookshop page where you can find that workbook and all of the books that we mentioned here today. So many great resources. Michelle, Dr. Tollefson, thank you so much for joining us today.
Thank you again for spending this time with us. I feel like, I learned so much, and I just think this is going to be a great resource for all of our patients, and we really appreciate your time.
Of course.
Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review The Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.